What kind of food did patients in Victorian asylums actually eat? It depended on whether you were a rich or a poor patient, where you were located, and what kind of illness you actually had. You probably had porridge or bread in the morning, accompanied by coffee and tea. As a midday meal, maybe some bread and cheese. And the biggest meal of the day would usually be dinner. You would have meat, maybe some potatoes and vegetables, and occasionally a pudding. Of course, these menus would also change and expand depending on whether or not it was a holiday like Christmas or Easter, or some sort of event like a patient ball. It's also worth noting that for some poorer patients, the care that they received at these asylums, so having access to a bed, to clean clothing, to regular bathing, as well as scheduled meals during the day, was an improvement on their experiences outside of the asylum walls. In some cases. Unfortunately, as asylums became underfunded and therefore overcrowded and understaffed, the conditions within these institutions and the quality of the diets also declined. You might be surprised to learn that up until the end of the 19th century, beer, as well as some other forms of alcohol like wine and sherry, was actually a staple in some English asylums. During regular meal times, patients could be provided with a half pint or a pint of beer. Now, another reason why thinking about food in the asylum setting was important was because it was actually part of the moral therapeutic regime. Remember that moral therapy was about trying to understand the patient, trying to get them to regain this sense of rationality, reason that they lost to insanity. But to return these patients to a so-called reasonable state, their environment had to be optimized, and that included the food that they ate. Let's say you were diagnosed with melancholy, which is something we might think of as depression today. How would your diet differ from that of any other patient? Well, maybe because you were melancholic, you weren't eating enough, and so these physicians would consider you to be starving. And that would mean that you had access to higher quantities of food and energy-rich foods like milk and eggs. If you experienced something called mania and were recovering from an episode or from this excitement that you experienced, you were depleted of your energy, and you too would have been provided with liberal quantities of food. Keep in mind, if you were thought to need food and yet you refused it, you were at risk of being force-fed. And this is regardless of whether you were suffering from something we might consider an eating disorder today, or you were paranoid about being poisoned through your food.